What's in the sac? A rare case of a scrotal pyocele. Introduction. Scrotal pyoceles are uncommon collections of purulent fluid between the visceral and parietal tunica vaginalis, usually secondary to acute epidermal orchitis, intra-abdominal infection, or trauma. Scrotal pyoceles can be distinguished from a hydrocele by the presence of internal echoes consistent with debris, septations, or loculations. A pyocele is a rare urologic emergency and an indication for prompt surgical exploration. Case presentation. Here's a case of a 70-year-old male presenting with dysuria, scrotal swelling, and testicular pain. On primary survey, vital signs were within normal limits. Physical exam was remarkable for right scrotal edema, erythema, warmth, and moderate tenderness to palpation. No flank pain, penile discharge, or penile lesions were noted. Laboratory evaluation was notable for a creatinine of 1.27 milligrams per deciliter, hemoglobin of 11.2 grams per deciliter, and hematocrit of 32%. Urinalysis was significant for white blood cells greater than 100 per high-powered field, 3 plus leukocyte esterase, 1 plus blood, rare bacteria, and negative nitrites. Testicular ultrasound revealed diffuse scrotal swelling and a complex right hydrocele with septations, seen to the left in Figure 1. Urine culture and blood cultures were drawn. The patient was initiated on vancomycin and ampicillin sulbactam, and a Foley catheter was placed. Urology was consulted for incision and drainage. The patient had an incision and drainage performed, revealing a right hydrocele containing yellow jelly-like fluid, hemorrhagic tunica albuginea, and thickening of the epididymis and spermatic cord. Surgical cultures, blood cultures, and urine culture revealed no causative microorganism. The patient recovered uneventfully and was discharged 2 days after incision and drainage with a 10-day course of amoxicillin clavulanate and doxycycline. Discussion. As with most testicular pathology, ultrasound is the preferred method of diagnostic imaging. The imaging hallmarks of a scrotal pyocele include internal echoes that move away from the transducer that represent cellular debris, septate, or loculations. If there is concern for tracking infection or deep structure involvement, a CT may be acquired. Klebsiella, Streptococcus, Clostridia, Staphylococci, and E. coli have all been implicated in cases of scrotal pyoceles or Fournier gangrene. As a result of the wide variation of microorganism growth, the treatment for scrotal pyocele involves broad-spectrum intravenous antibiotics and an urgent urologic consult for surgical drainage. This case illustrates a rarely described urologic emergency that must be recognized and treated quickly to prevent testicular damage or Fournier's gangrene. Pyoceles are commonly associated with acute epidermal orchitis, and treatment requires broad-spectrum antibiotics and surgical drainage. Many patients, however, ultimately require orchectomy. Early diagnosis, urology consultation, and initiation of treatment to limit complications are important to prevent the progression of this condition. References below. Thank you.